glenohumeral joint osteokinematics. Suppose if we see kinematics, wherever we see kinematics, it is nothing but the movements. Kinematics is nothing but the movements. Kinetics is nothing but the forces. Kinetics is nothing but forces. Kinematics is about the movements. So here in this kinematics, as we all know, we will see two kinematics. First one osteokinematics. Second one arthrokinematics. Osteo and arthrokinematics. What is this osteokinematics and arthrokinematics? Suppose if we take two bones, the movements which are happening between the articular surfaces, those movements are called as the arthrokinematics. Osteokinematics, the movement other than arthrokinematics which is happening in the bone, is called as the osteokinematic movement. Clear? Now we will see what are the osteokinematic movements for the glenohumeral joint. In glenohumeral joint, we have osteokinematics. Here we will be having osteokinematics. First one, flexion movement is there. Second one, extension movement. Third one, abduction movement. Fourth one, adduction movement. Fifth one, internal rotation, also called as the medial rotation. Last one, external rotation, also called as lateral rotations. These are the movements we are having in the glenohumeral joint. So here what we will see in this osteokinematics. Here osteokinematics is nothing but the movements which are happening other than the arthrokinematics. Here in this osteokinematics we have flexion, extension, abduction, adduction, IR and ER, internal rotation and external rotation. Here in these movements what we will see in osteokinematics, which muscles are responsible for the each and every movement, at the same time which axis this movement is happening, which plane the movement is happening, and what is the normal range of motion, for this all the movements, that we will see in the osteokinematics. Suppose if we see flexion, if we take flexion movement, which muscles will be responsible for flexion movement in the shoulder joint? First one, anterior deltoid muscle and coracobrachialis muscle and pectoralis major muscle and biceps brachii muscle. So these muscles will be responsible for the glenohumeral joint flexion. After that, which axis and which plane the movement will happen? Usually flexion extension will happen in the sagittal plane and frontal axis. After that, we have to see what is the normal range of motion of the flexion. Usually shoulder flexion range 0 degrees to 180 degree, but it will vary individual to individual. This is about shoulder joint, glenohumeral joint flexion ka osteokinematics. Now we will see extension. If we take extension, here in extension, first one, muscles. Which muscles will be responsible? First muscle, posterior deltoid muscle. After that, latissimus dorsi muscle. Then teres major muscle. After that, triceps. Muscle. So these muscles are responsible for the extension movement, and axis and plane. Here also same, frontal axis and sagittal plane. And what is the range of motion for the extension? Usually 0 degrees to 50 degrees. Sometimes it may come to 60 degrees also. 0 to 50 degree. Sometimes it may come to 60 degree also if the patient is hyper flexible. Now we'll see abduction movement. If we take abduction, in this abduction, so what is the osteokinematics of the abduction? First one, muscles. Which muscles will be responsible for the abduction? First muscle, supraspinatus muscle. After that, middle deltoid. Then trapezius muscle. After that, serratus anterior muscle. So these muscles will be responsible for the abduction movement. After that, axis and plane. Here, which axis, which plane? Usually adduction will happen in the frontal plane. And axis will be sagittal axis and frontal plane. Then range of motion. What is the normal range of the abduction? 0 to 180 degree. It will vary individual to individual. This is about abduction. Now we will see adduction movement. Suppose if we take Adduction. This is also osteokinematic movement. No? So here adduction, first point, muscles, which muscles will be responsible? First muscle, pectoralis major muscle. After that, latissimus dorsi muscle. After that, teres major muscle. So these muscles will be responsible for the adduction movement of the shoulder joint. Then axis and plane, same like abduction here, sagittal, axis and frontal plane. And range of motion, what is the range of motion? If we see abduction 0 degrees to 180 degree, adduction, it is a reverse movement, 180 degrees to 0 degree. This is adduction normal range of motion. Now we will see internal rotation. If we take internal rotation, also called as the medial rotation of the shoulder, medial rotation. First point, muscles. Which muscles will be responsible? First muscle, subscapularis. This is the first muscle. Second one, pectoralis major muscle. Then latissimus dorsi muscle. Then teres major muscle. So these muscles will be responsible for the internal rotation. Then axis and plane. Here this movement will happen in the transverse plane and vertical axis, transverse plane and vertical axis. And range of motion, what is the normal range? 0 degrees to 90 degree. This is about internal rotation. Now we will see external rotation. If we take external rotation, also called as the lateral rotation of the shoulder joint. First point, muscles. Which muscles will be responsible? First muscle, infraspinatus muscle. Second one, teres minor muscle. These two muscles will be responsible for the external rotation. After that, here we will see axis and plane, same like internal rotation or medial rotation. Here vertical axis and transverse plane. Here after that, range of motion, here also 0 degrees to 90 degrees. So this is about the glenohumeral joint osteokinematics. In this osteokinematics, we will tell what is the movement. Okay, suppose here we will see external rotation, one movement is there. Which muscles are responsible for that movement? Which axis movement is happening? Which plane movement is happening? What is the normal range of movement? This is about the osteokinematics. Next topic we'll see what are arthrokinematics. Clear?